Hello, my name is Anne and I'm a Divisional Nurse Director for Medicine and Urgent Care at Portsmouth Hospital University Trust. In 2019, I had the opportunity to embark on a Florence Nightingale Aspiring Nurse Director Scholarship. At this time, I was working as a nurse consultant within a secure inpatient unit with leadership responsibility for improving physical health care for patients with severe mental illness. I've worked in a variety of nursing roles within the NHS and have an interest in nurse development, advanced practice and professional leadership. The Aspiring Nurse Director Scholarship gave me the opportunity to explore my leadership skills and how I could develop and utilise these in a wider context to affect change and to impact on ongoing developments in nursing. As I made plans for 2020, Year of the Nurse and Midwife, I was not prepared for the impact of the COVID-19 pandemic. I aim to share my reflections of the programme, an insight into my improvement project and how the scholarship experience has impacted on me as a nurse leader. The scholarship experience has afforded me many opportunities for personal and professional development, and in December 2020 I took up post as Divisional Nurse Director for Medicine and Urgent Care at Portsmouth Hospital University Trust. My scholarship experience. I didn't know what to expect. I didn't know anyone. I felt really nervous but really excited. I lived in the North East at the time and I needed to travel regularly to participate in the programme. There have been many highlights and I've enjoyed and learnt from every experience. The biggest highlight for me has been the development of friendships and relationships with my fellow scholars. As a group, we have developed a support network of like-minded people who all share a passion for nursing and nurse leadership. This has enabled peer support, guidance and advice, sharing of policy, guidelines and developments, ongoing action learning sets, and a real strength of honesty, safety and reflection. The development of these relationships was supported by the programme delivery. I place real value on the opportunity to explore myself, my leadership style and the impact of that on others, and to really hone down what my development needs were. This enabled me to maximise my scholarship experience. Standout moments for me have been the RADA experience and the Windsor Leaders Programme. I'm not going to lie, when I first arrived for RADA I was terrified. It turned out to be the most amazing experience. There were tears, there was laughter and lots of fun. I moved out of my comfort zone and saw my confidence grow and flourish, and I've been able to continue using these skills in my daily work. And I've gone on to secure a Divisional Director of Nursing post. There have been times where I've really struggled with imposter syndrome. The realisation that I deserved to be here came during the Windsor Leadership Programme. Our action learning continues and we've developed a bond and a team that I hope will continue for many years to come. It has been a real honour and privilege to call myself a Florence Nightingale Scholar, and I'm thankful for the experience and the development that it has given me. My improvement project aimed to address a number of quality and safety issues directly related to the delivery of physical health care for patients in a secure inpatient setting who were experiencing severe mental illness. My project was the introduction and establishment of a physical health ward round within the secure setting. The rationale for the project was following a thematic review of physical healthcare delivery and the learning points. The older population group with complex needs, a high acuity of physical illness and comorbidities, a high rate of falls, a high rate of infections, a high rate of acute hospital admissions, high level of nursing need, and a reactive rather than proactive approach to care. So the aim was to improve routine monitoring, to have early identification of illness and deterioration, to have proactive interventions, to improve communication and engagement of the whole MDT, and to ensure comprehensive physical health intervention plans were in place, to increase the level of physical health team support within the ward environment, and to enhance the skill set of the nursing team. So the overall aim was to deliver parity of esteem, to improve outcomes for patients with severe mental illness and to ensure parity in terms of their access to care, to improve the patient experience and journey by proactively managing and having a responsive approach to care, and by responding to incidents and learning events as they came up. It was important to provide the evidence and rationale for the change and to ensure the skills and experience were available to deliver and that the resources were there that could support. There was a review of healthcare available to the general population, such as long-term condition monitoring, national screening programmes and access to services. There was a review of incidents such as falls, VTE, pressure ulcers, infections. It was important to understand how this could all be delivered within the secure environment and within the skill sets that were available. The project included the development of a visual control board to support the delivery and consideration of physical health needs. This was owned by the ward team. There was development and delivery of training packages for mental health staff to improve their confidence and their skills and ability in managing physical healthcare requirements. There was engagement with the senior medical teams and engagement with the primary care teams to support implementation of the ward round. I worked across systems and professions to enable implementation of a physical health ward round and the delivery of physical health care and parity for our patient group. The impact of this project for patients, staff and the organisation was significant. We successfully nursed a number of patients to end of life, which included identification of preferred place of care, early recognition of palliative care needs, early implementation of DNA CPRs, management of syringe drivers and subcut lines and medications, and an established network with the palliative care team. There was a significant improvement in communication, both within the multidisciplinary team and with our system partners. There was improved access to physical health care, improved compliance with routine monitoring, a reduction in inappropriate acute hospital admissions, a reduction in falls, and greater access to aids and adaptations. And these outcomes were measured by clinical audit, a review of incidents and complaints, compliance with the national audit of care at the end of life, review of patient experience data and staff experience data, and this was also measured out with the national tools. And then there was a review of acute hospital admission data and the appropriateness of this. Overall, there was increased confidence in the staff team dealing with physical healthcare issues. Relationships across the system improved and unnecessary acute hospital admissions reduced. Patients received parity of physical health care and a proactive approach to physical health care management. This resulted in improved pathways of care, improved long-term condition management, leading to a reduction in acute exacerbations and complications of illness. I would like to end my presentation by thanking a number of people for supporting my development throughout this scholarship. I will start by thanking the Florence Nightingale Foundation and Health Education England for first of all believing in me and providing the opportunity, the funding and the support without which I would not be where I am now. I would like to thank my mentor Chris Caldwell for her support, time, encouragement and wisdom. She has been a terrific mentor and role model. I would like to thank the people I've met throughout RADA, Windsor leaders and colleagues nationally who have supported me on my journey. So many have given their time, shared their experiences and given encouragement. And finally, thank you to my wonderful peer group, the Scholars of 2019, all of whom have provided unconditional support, kindness and friendship. My experience throughout the scholarship has enabled and supported my progression to the next step in my leadership journey. It has supported my growth and development and has enabled me to share my passion with others. Thank you.